From Tri-Town Chiropractic office in Foxboro, Massachusetts. I'm here to share some information with you about thoracic spine, mid-back pain, and rib pain. I hope this information will help you in relieving these painful conditions. So, oftentimes people will present with severe knife-like sharp pain in the rib cage, upper back, mid-back, and it can be a result of any common daily activity, sports injury, lifting, bending, twisting, or sneezing. But most people describe a very sharp, stabbing pain in the rib cage, in the rib, or the mid-back that hurts incredibly when you breathe, move, twist, or do just about anything. Oftentimes people are told that this condition is costochondritis, which is another condition that is typically pain in the front where the rib cage, where the ribs turn to cartilage. There's a junction there between bone and cartilage that gets injured. It's very painful. That's costochondritis. It's a condition that exists, but it's just not that common. It's the rib and thoracic spine pain is commonly called costochondritis, and it's just not right. Other conditions that could mimic this mid-back pain problem is commonly thought is shingles. And shingles is relatively common, but it's not always the diagnosis, and the presence of these mid-back and rib problems have to be sorted out by somebody qualified, like me. So what we're talking about here is the thoracic vertebrae. The thoracic vertebrae go from the bottom of the neck to the top of the low back, so all the vertebrae that have the ribs attached to them. So this is a thoracic vertebrae, and I've drawn one here, kind of decent but not really that good, but you get the idea. So what happens here is, here's the spinal bone, the rib comes around and attaches to the spinal vertebrae, much like that. They attach with these two joints, the costovertebral joint, or where the rib attaches to the body of the vertebrae, and the costotransverse joint, where the rib attaches to the transverse process, this bony thing on the side of the vertebrae. Now, this is all part of your respiratory apparatus, your breathing. It's kind of important. So the way it's set up, that there's a lot of sensory nerve endings in the thoracic spine, particularly where the ribs attach to your spinal bones. They're very, very, very pain sensitive. So when something goes wrong with them, it hurts like a son of a gun, and that's why thoracic and rib problems are so painful. So what we know about these things is that they will improve very, very quickly. I can't stress that enough with chiropractic treatment. The issue with these is that there is problems with the mobility of these little joints where the ribs attach to your spine, and by restoring mobility and proper positioning of those bones, you get tremendous amounts of pain relief. That, coupled with just ice pack therapy and some stretching exercises, lifestyle modifications, offer tremendous and immediate relief with these conditions. Chiropractic works great for neck pain, back pain, low back pain, sciatica, all these things. But this is where chiropractic shines like crazy. These rib problems, these thoracic spine problems are very, very painful. The relief is rapid and incredibly effective. So if anybody knows anybody that has these kinds of conditions, or if you've suffered with this in the past or having it right now, call me. I'd be happy to talk to you and answer any questions that you have regarding the matter. I hope this is helpful and valuable information for you. This isn't a very well understood condition in medicine, but in the chiropractic field, it's a proven and safe method of treatment for these very, very painful syndromes. If you don't have shingles and you don't have any other conditions or fractures or anything like that, we can help you. So please, I hope you find this information valuable and helpful. Keep it on in the back of your mind in case something like this happens to you. Thanks for watching.